She thought it was just the humidity in the air. Mary, one of my 64-year-old patients, was out in her garden tending to her roses, just like she did every Tuesday morning. She felt a vague discomfort, something she later described as a feeling of being out of sync. It wasn't pain. It wasn't that crushing chest pressure you see in the movies. It was just a slight shift in her rhythm, something she brushed off as a bad night's sleep or perhaps a bit of indigestion. Mary ignored it. She went inside, drank a glass of water, and carried on with her day. On Wednesday, the signal returned, slightly more persistent. On Thursday, it was there again, like a constant whisper. By Friday morning, Mary wasn't in her garden. She was on my operating table, and I was fighting against the clock to clear a coronary artery that was 99% blocked. What Mary didn't know, and what most people watching right now don't realize, is that the heart almost never stops without warning. It isn't a light switch that just burns out. It is a sophisticated engine that begins to make strange noises days before it fails completely. There is one specific sign, a sign that appears exactly 3 days before a catastrophic cardiac event. It is your body's final warning, a biological ultimatum that, if ignored, can mean the difference between a long life and a sudden tragedy. I'm Dr. Jason Watanabe. Throughout my career, I have performed over 800 heart surgeries. I have held human hearts in my hands and seen, up close, the scars left behind by signals that were neglected. Most of my patients tell me the same thing after they recover. Doctor, I felt something strange a few days before, but I didn't think it was important. Today, I'm going to reveal exactly what that number one sign is, the 72-hour warning your body sends to save its own life. I will explain why your heart chooses this specific signal, why it is so easy to confuse with common health issues, and most importantly, exactly what you must do the moment you feel it. Mary was lucky. We reached her in time, but many are not. In the next few minutes, I am going to ensure you never ignore the whisper of your heart again. But first, we need to understand the language of stress your cardiovascular system uses when it is about to collapse. To understand why your body gives you a 3-day warning, you have to understand what is actually happening inside your chest during those 72 hours. Most people think a heart attack is like a car crash, sudden, violent, and unavoidable. But as someone who has spent thousands of hours looking at the human heart, I can tell you it's much more like a dam that is slowly starting to leak. 3 days before the crash, the leak is already there. Your coronary arteries, the small vessels that supply your heart muscle with life-giving oxygen, are reaching a breaking point. They aren't completely blocked yet, but they are struggling. And because your heart is the master pump of your entire body, when it struggles, your whole system begins to compensate. Your body is incredibly smart. It starts to divert energy. It starts to prioritize. It chooses which organs get the most blood and which ones have to make do with less. And this is exactly why the number one sign, the one Mary felt in her garden, is so easy to dismiss. It doesn't feel like a medical emergency. It doesn't feel like you're dying. It just feels like you're having a heavy day. I call this the pre-attack syndrome. During this 72-hour window, your heart muscle is essentially screaming for help, but it doesn't have a voice. Instead, it uses your nervous system to send signals to other parts of your body. This is a phenomenon we call referred sensation, because the nerves that go to your heart are bundled together with the nerves that go to your neck, your jaw, and even your shoulders. The brain gets confused about where the trouble is coming from. This is why Mary thought she just had a bit of a stiff neck from gardening. She thought her body was just tired from the heat. But there was a specific quality to that tiredness, a weight that was different from anything she had felt in her 60 years of life. In the next few minutes, I'm going to describe that weight in detail, because if you feel it tonight or tomorrow morning, you don't have days to wait. You have hours to act. But before I reveal the specific sign, I need to tell you about David. David was 70, and he felt the exact same thing as Mary. But David made a choice that almost cost him everything, and his story illustrates the 72-hour trap that kills thousands of seniors every year. David was a retired engineer. He was a man who appreciated logic, numbers, and systems. He knew his body well, or at least he thought he did. At 70 years old, he walked 2 miles every morning without fail. But on a Wednesday afternoon, something changed. He was doing some light yard work when he felt as if someone had draped a heavy lead vest over his shoulders. He wasn't gasping for air. He didn't have a sharp pain in his chest. He just felt drained. It was a deep, bone-weary exhaustion that made even the act of lifting a garden trowel feel like he was lifting a sledgehammer. David fell into the 72-hour trap. He sat down on his porch and told himself, "I'm just getting older. I must have pushed it too hard today." He went inside, took a nap for 3 hours, and expected to wake up refreshed. But when he opened his eyes, the lead vest was still there. In fact, it felt heavier. This is the first stage of the warning sign I'm talking about. In the medical world, we call this prodromal fatigue. It's not the kind of tired you feel after a long day at work. It's a profound, systemic lack of energy that rest cannot fix. Why does this happen? Because 3 days before a heart attack, your heart is already struggling to maintain its cardiac output. It is struggling to push enough oxygenated blood to your brain and your limbs. Your body, in its infinite wisdom, begins to shut down non-essential systems to protect the core. It pulls blood away from your large muscles to keep the brain and heart alive. This creates a sensation of heaviness in the arms and legs that is often accompanied by a dull, vague discomfort in the upper back or shoulders. David waited. Thursday came, and the heaviness moved into his jaw. He thought he had a toothache. He took an aspirin and went back to bed. By Friday morning, David wasn't just tired, he was gray. By the time his wife called the ambulance, his heart had been suffocating for nearly 48 hours. David survived, but he paid a terrible price. Because he ignored the 72-hour warning, a significant portion of his heart muscle was permanently scarred. He will never walk those 2 miles again. He now gets winded just walking to the mailbox. I don't want you to be David. I want you to recognize the lead vest for what it truly is. A desperate cry for help from a heart that is about to fail. But there is a second part to this sign, a physical change that happens in your breathing that is the #1 indicator that the 72-hour clock is ticking. The second part of this 72-hour warning is what I call the invisible staircase. Most of us, as we get older, expect to be a little winded if we climb a flight of stairs or carry a heavy bag of groceries. We tell ourselves it's just our lungs getting older. But 3 days before a heart attack, your breathing changes in a way that has nothing to do with your lungs. Imagine you are walking on flat ground, perhaps just moving from the kitchen to the living room. Suddenly you feel as if you are climbing a steep hill. You aren't gasping for air like you just ran a sprint. Instead, it feels like you can't quite get a full breath. It's as if your lungs have shrunk, and no matter how deep you inhale, the air just isn't feeding you. As a surgeon, I see the mechanical reason for this. When the heart muscle begins to fail due to a lack of blood flow, it can't pump the blood forward fast enough. This causes a backup. Think of a drain that is partially clogged. The water starts to pool. In your body, that blood starts to back up into the vessels of your lungs. This makes the lungs slightly stiffer and less efficient at exchanging oxygen. This is the invisible staircase. It is a subtle, persistent shortness of breath that occurs during activities that used to be easy for you. If you find yourself needing to stop and catch your breath while doing something as simple as making the bed or getting dressed, your 72-hour clock is ticking. I want you to try something I call the sentence test. It's a simple tool I give my patients to use at home. If you are feeling that lead vest heaviness I mentioned earlier, try to speak a long sentence out loud, something like, "I think I'll go to the kitchen and make a cup of tea before I sit down to read the paper." If you have to pause for a breath in the middle of that sentence while standing still, your heart is struggling to maintain the pressure in your system. This isn't just being out of shape. This is a physiological red alert. Your heart is telling you that its reserve capacity is gone. It is using every ounce of its energy just to keep you upright. But there is one more piece to this puzzle, a strange, nocturnal sign that happens while you are trying to sleep, which often convinces people they just have a nervous stomach. It's 2 o'clock in the morning. You wake up suddenly, not because of a loud noise, but because of a strange, gnawing discomfort in the pit of your stomach. You feel bloated. There's a burning sensation rising into your throat. You tell yourself, it was the spicy food at dinner, or I just have a bit of acid reflux. You reach for an antacid, swallow it down, and wait for relief. But the relief never comes. This is the third and perhaps most deceptive part of the 72-hour warning: cardiac-induced indigestion. I've seen this countless times in the emergency room. A patient comes in with a massive myocardial infarction, and when I ask when the trouble started, they say, "I've had a nervous stomach for 3 days. I thought it was just something I ate." As a surgeon, I can tell you that your body is playing a dangerous trick on you. The bottom part of your heart, the inferior wall, sits directly on top of the diaphragm, which is the muscle that separates your chest from your abdomen. When that part of the heart isn't getting enough oxygen, it becomes irritable. It sends distress signals through the vagus nerve, the same nerve that controls your stomach and digestive tract. Your brain gets the signal, but it can't always tell where it's coming from. It interprets the heart pain as stomach pain. This is why people experience sudden nausea, a loss of appetite, or a feeling of fullness even if they haven't eaten. Here is the red flag test for this specific sign. If you have what feels like heartburn, but it is accompanied by a cold, clammy sweat, or if that lead vest heaviness I mentioned earlier is present, you are not having a digestive issue. An antacid will not fix a blocked coronary artery. In my experience, when a senior says they have the worst indigestion of their life and they look pale or gray, I don't look at their stomach. I look at their heart. This nocturnal discomfort is often the final warning before the 72-hour window closes and the crash occurs. We have now covered the lead vest fatigue, the invisible staircase breathing, and the fake heartburn. When these three things converge, you are in the eye of the storm. But there is one final neurological shift that happens, a strange feeling of doom that many people ignore because they think they are just being anxious. There is one more sign that is perhaps the most difficult to explain to a doctor because it doesn't involve a physical ache or a lab result. It is a psychological shift that I have heard described by hundreds of patients in the moments before they lost consciousness. I call it the shadow of doom. During that 72-hour window, many people experience a sudden, overwhelming sense of anxiety. But it isn't the normal kind of worry we all feel about our bills or our families. This is a cold, hollow feeling that something is deeply, fundamentally wrong. It's a sense of impending disaster that you can't quite put into words. As a surgeon, I know this isn't just in your head. It is a biological survival mechanism. When your heart is struggling to maintain the pressure in your brain, your body's emergency broadcast system takes over. It floods your system with catecholamines, stress hormones like adrenaline. Your body is trying to kickstart the heart, but the side effect is an intense feeling of panic or unease. I've seen patients sit in the waiting room looking perfectly fine, but they tell the nurse, "I just feel like I'm not going to be here tomorrow." Too often, those patients are dismissed as being anxious or told to just relax. But in my world, a sudden sense of doom in a person over 60 is a clinical red alert. It is the brain's way of acknowledging a crisis that the heart hasn't fully realized yet. When you combine this shadow of doom with the lead vest fatigue and the invisible staircase breathing, you aren't just at risk. You are currently in the middle of a cardiovascular event that is unfolding in slow motion. Mary, the patient I mentioned earlier, felt this. She was in her garden, and she suddenly felt a wave of wrongness so strong she had to sit down. She wasn't a nervous person, but she felt a sudden urge to call her daughter just to say she loved her. She didn't know why. Her brain was reacting to the lack of oxygen by triggering a fight-or-flight response, even though she was just standing among her roses. If you ever feel a sudden, unexplainable darkness, or a sense that your time is running out, especially if it's accompanied by any of the physical signs we've discussed, do not try to calm down. Do not take a sedative. That feeling is your body's final flare being shot into the night sky. The lead vest is not a suggestion. It is a command from your heart to stop. Most people believe that a heart attack is a sudden explosion, but in the surgical world, we know that most attacks are preceded by what we call plaque erosion. This is a slow, jagged tearing of the artery wall that happens over approximately 72 hours. This is your golden window. In these 3 days, we can often stop the heart attack before it even starts. We can use specialized medications or a simple stent to stabilize the leak in the dam before it collapses. If you feel this specific combination, unexplained, soul-crushing exhaustion, shortness of breath while performing a simple task, and a sense of impending doom, you must act. Do not call your doctor's office and leave a message for Monday morning. Do not wait for your spouse to get home from work. You need to get to an emergency room. And here is a surgeon's warning. Never drive yourself to the hospital. When you are under the lead vest of a heart attack, your heart is electrically unstable. If it enters a fatal rhythm while you are behind the wheel, you are no longer just a patient. You are a danger to everyone on the road. Call emergency services. The paramedics are the only ones who can start the life-saving process in your living room with a portable EKG and stabilized oxygen. While you wait for the ambulance, if you are not allergic and your doctor hasn't told you otherwise, chew 1 full-strength adult aspirin. Do not swallow it whole, chew it. This allows the medication to enter your bloodstream through the vessels under your tongue much faster. Once there, it can begin to break up the microscopic clotting storm that is currently happening inside your coronary arteries. This one simple act can reduce the permanent damage to your heart muscle by up to 25% before you even reach the hospital. Let's look at Mary one last time. Mary didn't wait until she had crushing chest pain. She listened to the lead vest. She called for help when she realized she couldn't catch her breath among her roses. Because she honored the 72-hour warning, she is back in her garden today. Her heart muscle is whole. Her future is intact. She didn't ignore the whisper, so she didn't have to endure the scream. The human heart is the most resilient and impressive engine ever created. It works for you every single second, from months before you were born until this very moment. It doesn't ask for much in return, but it does demand to be heard. In my operating room, I see the consequences of silence. I see what happens when someone decides to wait until tomorrow to see if the fatigue passes. I don't want you to be that person. Remember the 72-hour protocol. If you feel the lead vest, that inexplicable exhaustion that seems to drain your very soul, if you feel the invisible staircase, that shortness of breath while doing simple tasks, or if your stomach clock starts triggering indigestion that doesn't go away with normal medicine, pay attention. Your body is firing an emergency flare in the middle of the night. Mary heard the whisper. David waited for the scream. The difference between the two wasn't luck, it was action. Recognizing that you aren't just getting older, but that your heart is fighting for oxygen, is the most courageous act you can take for your health and your family. Don't try to be a hero by ignoring the pain or the discomfort. The real hero is the one who is alive to see their grandchildren grow up because they had the wisdom to ask for help when the body warned them. Your life is too precious to be risked for the sake of an, "I thought it was nothing." Protect your heart, and it will continue to protect you. I want to hear from you now. Our health community has no borders, and prevention is our common language. Where on this planet are you listening to me from right now? Let me know in the comments below. I read as many as I can because it reminds me that every person watching is a life we can save. And more importantly, I want us to share our experiences to help others. Do you know someone, a friend or a loved one, who has suffered from a heart attack or the signs we discussed today? Comment who they are and briefly tell their story. Sometimes reading your account is exactly what will give someone else the courage to see a doctor today. If this information opened your eyes, please hit the like button and share this video. You might literally save a heart today. I'm Dr. Jason Watanabe. Listen to your body, honor your heart, and take good care of your health.